I am Dr. Latif Küpelioğlu. I am 43 years old. I have been graduated from medical school in 1994, and after this I become a obstetrics and gynecologist. And last 15 years I have been worked in infertility treatment. This is my subspecialty. Here is the IVF unit. We are checking the patients who suffers from conceiving babies. This means we can care about women and men together because the couple is our patients. First of all, we can describe the infertility. Infertility is a couple cannot conceive a baby more than 1 year. In more than 1 year, if they cannot conceive, this is infertility. And after this, people come us for searching the reasons, and we can check them. First of all, we can check the man, because it's very easy. Just 2 samples of semen analysis can describe many things. But women's research is more complex. We examined the patient with ultrasonographically, and after this we want hormone profiles and radiographic view of the tubes, women's tubes. And after all, we can describe 90% of the cases as a result. Some people can find support about more simple treatments like intrauterine insemination or just ovulation inductions, but some people need in vitro fertilization treatments. As you know, in vitro fertilization treatments are a separate treatment choice because there is a laboratory level. First of all, we should examine the woman, and we can describe a protocol for her, and after this we pick up the eggs from her body, and we collect the semen and sperm from the man, and in the laboratory in vitro conditions we can perform microinjections. And this means in vitro fertilization treatment. The success rate is very important in this section. If a unit has more than 40% success rate, this is a very good thing, because in the general world, if you have more than 40%, you are very successful IVF unit. In my clinic, our success rate in year over year almost more than 50%. If we should say exactly, 54% in a year our success rate. Sometimes we need surgical approach to the IVF patients. For example, if the couple have some problems about man or woman, we care just women's surgery, and in our hospital our urologic teams care about men. For example, varicocelectomy or surgical sperm retrieval treatments are performed by our urologists. But in the IVF unit, all gynecologists are performing endoscopic approach to the infertile women. For example, myoma uteris, endometrial polyps, and uterine anomalies. They are congenital, and sometimes in other conditions we can perform the endoscopic surgery. Sometimes first we should surgery and after IVF treatment together. And we are serving all patients from all over the world. And as you can guess, from the Bosnia-Herzegovina, we have some patients, and if we have these patients, the patients should learn that they will pass some time in Turkey, because in IVF treatment, at least 15 days we need for total IVF treatment. Actually, we are not talking about the best, the number one, but the number one leak, as you can understand. For example, some developed countries, United States of America, Canada, Belgium, and England, Australia, and in this league, we are in this league, Turkey, because to become a baby is more important in our country, maybe respectively to the other developed countries, and in this need, the doctors can go this section to become more improving doctors. So the all technological system are well organized in Turkey, and there are many good IVF equipments and the teams in Turkey. First of all, as I told, we are in the first league according to success rate, and maybe sometimes, as you guess, cultural conditions between the countries can make a choice, because Bosnian people and the Turkish people had a historical relationship between each other. Yes, and it's continuing now in today. And if a Bosnian couple needs a good IVF treatment, I think Turkey and our hospital, medical park, can be chosen firstly. In 2010, I have gone to Pristina, Kosovo, and I have asked the colleagues in which are working there, how much cost does the patient pay for an IVF treatment in Kosovo? They told me that just for the hospital price, more than 2,000 euros, and it will be at drug prices, okay, and maybe some tests, samples. But in my country, the IVF price is less than 2,000 euro, and it's I think it can be a very good thing to choose this hospital or this country.